Hi, my name is Dr. Roy, and I'm a specialist oral and maxillofacial surgeon and implantologist. I work in Dubai. I'm making this video for all the patients who are looking for this treatment called as all on four. The patients are missing a lot of teeth in their mouth or have failing teeth, gum disease, either their teeth are moving and have basically very few teeth left in their mouth. And I just thought I'll make a video which will give a lot of information as to what an all-on-4 is and what you should be looking out for when you go for an all-on-4 treatment. So all on four will involve that all the teeth that are there, which are moving, are removed, and simply four implants are placed, uh, two tilted at the back, and two straight implants in the front. And these four implants are supposed to take the load of 10 to 12 fixed teeth. The teeth that are given on the same day will be uh, quite simply denture or acrylic teeth, and after 4 to 6 months they can be zirconia teeth or porcelain fused to metal, which will also have artificial gum on them. All those things depend on the amount of space that you have in your mouth and what all can be accommodated in that space. This can be called as anything. Many names are there, and each company likes to call it their own technique. But actually, this technique was started by a company called Nobel Biocare, and they called it all on four. All on four meaning four implants you will be placing for giving 10 to 12 teeth. It can be all on six, where you place six implants to do the exact same procedure. All on X, then Strawman company has something called as a Pro Arch, uh, which is quite a similar technique and fast and fixed. Whatever you call it, the end result is quite the same, and the steps may differ here and there, but in the end, for the patient, the most important thing is that we are talking about maximum of 4 to 6 implants for a full set of teeth. This technique has changed over the years from us doing bone grafting and placing straight implants to tilted implants. And this technique was started by a very well-known surgeon called as Dr. Polamalu. So what Dr. Polamalu showed that instead of placing straight implants, and obviously straight implants are not possible in every case because either the sinuses are low because the patient is missing so many teeth for so long, and they have large sinuses, or in the lower jaw the nerve is very high. So what he said was that if we tilt the back implants, the success rate remains almost the same, if not better, in many cases. And in the past 20 years, he has shown almost a 98% success rate with this all-on-4 technique. And most importantly, when we are talking about any technique, it should be backed with good literature. That's what anybody wants to do. It's not you and me what we think should be right, but we should follow good literature, and all on 4 is backed with good literature. So the important thing to understand for you as a patient is that all on 4 can be done in many different ways. So how I may do the procedure and somebody else who's trained in a different way may do this procedure may be different, and your dentist may do this procedure in a different way. So even me, maybe 3 or 4 years back, how I used to do the procedure, I have quite quite dramatically changed it, and now with every case I try to make little changes so that the end result is as good, but also the patient experience is satisfactory, and the whatever said and done, it's a long procedure, and it requires a lot of patient compliance. uh, but there are so many different ways as to we can improve that outcome and make the patient very very relaxed on the dental chair. So these little changes I keep doing with every case, and uh, it seems to be working very very well. So I'll try to explain to you in very simple words how I do the treatment, and what the outline of this treatment should be like. I will try to divide this in about four parts, and uh, in the first part, when the patient comes to me and he tells me that, doc, I'm not happy with my smile. There are these teeth which are moving. Or if the patient is tired of wearing their dentures and they want a fixed solution. The dentures are basically, based on suction. So it can be quite embarrassing if that suction wears off when the patient is speaking to somebody and it just pops out. We have seen so many of those videos on YouTube and WhatsApp, and it may sound funny for somebody else who's watching it, but it is very embarrassing for that patient. So I try to understand what the patient's needs are, and I explain to them this all on 4 procedure. I always start off with a 3D scan or a CBCT X-ray. I have a in-house CBCT scanner in our clinic, and it tells you a lot of things. That CBCT scan. It shows you all the anatomic structures like the nerves, the sinuses, and the blood vessels. Uh, Whatever needs to be stayed away from when you're doing the implants, you can sit with the patient and show them, and that in turn gives the patient a lot of confidence as that everything is being planned very well. So in the first appointment, I take this 3D CT scan, sit with the patient, and it will be about a 45-minute appointment. And I check two very important things in this appointment. The first is the lip support, and the second is the transition line. Now, the lip support is something that I check standing on the side of the patient and looking at the face from the side, and I look at this particular area in simple words, and how depressed is it, and how much support will my new teeth need to give to this lip to create the fullness. Some patients don't need it. Some patients have pretty full lips. All on 4 is an ideal treatment option for them. But some patients, their chief complaint to me is that they want this lips to be slightly fuller. They want it to be pushed up. All on 4 per se does not do that. So I decline an all on 4 treatment for them, and I alter the treatment slightly, and I offer them another plan B, which is the best for lip support. The second thing that I check is called the transition zone or the transition line. Uh, in I'll again try to explain it to you in as simple words as possible. However, these are dental terms, but it's important that your dentist checks this. So there are some patients who smile and they show a lot of gum. Those patients are slightly tricky patients to treat with all on 4 treatment, and that's where this transition zone is so important. Now the final teeth that we will give you, it will have teeth, and above that it will have artificial gums in one framework that will go and sit on top of your own gums. Now, when you smile, if you show a lot of gum, you will show that point where your gum goes and fixes on to the artificial gum that we will give you as the final processes. So every time you smile, somebody will be able to look at you and tell you that, oh, these teeth, you've gotten it done from somewhere, and it does not look very good because it looks different. There are two types of gums. One is your own, and one is the one that the dentist gives you. So the aim of this determining this transition zone is that if you show that we do something called as bone reduction, so that when the final teeth and these artificial gums are given, it is hidden under your lip, so that when you smile, even with the widest smile, you do not show your own gum. The only thing that you show is the gum that we give you. So this is usually the first session, and maybe one or two more sessions where the patient has few more questions. And basically, I ask my lab to prepare simple dentures, simple denture teeth for the surgery day. If the patient has his own teeth, then I make something called as immediate dentures, and what they do is in your cast they will remove the remaining teeth that you have, and based on that they will make temporary dentures and give it to me. On the day of the surgery, this temporary denture will be converted to your temporary teeth, and in a way that the palate will be cut out of that denture, so that you can taste your food, so it actually feels very very real and not like dentures. The last thing that I also get made, and it is a very important part of the way I do this technique, is I get my lab to make clear acrylic duplicate denture, and it is an exact replica of the denture that they have just made. And I make them do a few markings on that clear acrylic denture, which helps me do an exact bone reduction, so that after the surgery, when the patient smiles, it looks absolutely beautiful. So once the dentures are ready, then we are also ready for the final surgery day. And the final surgery before the final surgery day, I prescribe a few things to the patient, like typically an antibiotic, 1 gram augmentin about half an hour to 1 hour before the procedure, because the antibiotic prior to the procedure has shown that it reduces the chances of any infection. And I prefer giving Voltaren 75 mg, one tablet before the procedure, and some sort of very mild sedative like a diazepam, 5 milligram or 10 milligram. So by the time that diazepam wears off, we are actually done with the surgery procedure. So our surgery typically starts around 8 o'clock in the morning, and max I'll finish by about 10:30, and this is the most difficult part of the procedure for the patient. At least that's what they think, because after this there is no need of any anesthesia, because the patient will just be waiting around in the waiting room, and there'll be quite a few of tightening and unscrewing movements, and we'll be doing different things to just make sure that the teeth that we give fit perfectly. uh, I have a way of doing this surgery in such a way that there is no pain during the procedure. I start off with the anesthesia, and even before the anesthesia, it is very important to give some sort of topical anesthesia, so that even the prick of the injection is not felt. And of course, after once the injection takes effect, and if you give it about 15 minutes, then it's as comfortable as anything whatsoever. And by the time all these medicines that we gave the patient prior to the procedure and the anesthetics, they start wearing off, by 10:30 the surgery procedure is done with. It's a bi jaw all on four, then I prefer to do one jaw at a time, and maybe after a gap of 2 days, I'll do the other jaw. It's not that it cannot be done. Maybe your dentist may prefer to do both of them together, but I feel that a patient is much more comfortable if we do one jaw at a time. And even the lab is, absolutely up to the mark if you do give them time to do a good job, which is most important. The surgery procedure will also entail taking the patient's consent, and I like to take a few pictures of the patients so that whatever said and done, there's a cosmetic procedure, and it helps because sometimes the pictures show a totally different angle, which none of me and my team may have realized in our first or second appointment. Uh, After the procedure, I usually again put the patient on the same antibiotic that they had taken before the procedure, a mild painkiller like Voltaren, and also in some cases I give a prednisone tablet after the surgery, a 5 mg prednisone. It helps in reducing the swelling, the post-operative swelling, and the inflammation which comes in the first 2 or 3 days. Though I inform the patient that that's how the body tries to heal you by giving you a little bit of swelling, but then nobody wants that, and if we can minimize it, this is the best way to do it. So I have incorporated that in my practice very, very recently. A little bit I'll try to add about the surgery. After the patient is anesthetized, I make small cuts in the gum, and it's totally painless, and patient is mildly sedated, so they can understand everything that I'm telling them. And after that, I usually place the tilted implants first at the back, and then the front implants are pretty straightforward. Based on the back implants. Then we connect these multi-unit abutments on the implants, and the denture that we had made prior to this procedure, we make 4 holes in them, and through those holes we connect these multi-unit abutments. So quite simply, this entire denture framework is connected to 4 implants. So from 10:30 to 2 o'clock approximately, the patient is just waiting around. There's no need of any more anesthetics, and we are just trying to make the denture as beautiful as possible before we screw them onto the implants. So here the lab really plays an important part, where they come in and they help me convert this denture, and most of the things happen outside the patient's mouth. Just sometimes we need the patient just to check the fit, and checking the fit is the most important part of the second part of this procedure, and we take a lot of time to make sure that this part is perfect, because the very few failures that we see are usually because of this second part and not the surgery. So after the patient, I usually see them after about 3 or 4 days, once the swelling has slightly subsided. A little bit of bruising is expected in this surgery, and how much happens, it's basically patient dependent. So I always inform that to the patient. And we keep these temporary teeth on for about 4 to 6 months, and after that we replace them with either zirconia teeth, or porcelain fused to metal teeth, which are reinforced with a very strong material, and to last you close to a lifetime. Why it is so very important to wait for 6 months for the healing of your dental implants is that the gum really shapes and reshapes around your implants in these 6 months, and it also can cause some recession. So we want to not give you the final teeth before all this changing of the gum position has happened, and after 6 months most of it has happened, so we are very happy to take the measurements after 6 months. The final set of teeth, you can change the shape, shade, color, the amount that it pushes your lips. Everything is very custom designed for each patient, and we can change it as much as we want. Once the final set of teeth are fixed, we put the patient on sort of a recall, where we explain and show the patient how the hygiene has to be maintained. And every 6 months, they need to come back and meet us for the first 2 years. So that's it. I think I've tried to cover most of the things in this all-on-4 procedure or a dental implant procedure. So if you're a patient who's looking for an all-on-4 procedure, I hope this video helped you and enlightened you in a way as to what you should be asking your dentist and what you should be looking out for. If there are any more questions, please feel free to put it in the comments below, and I'll try my best to answer them as quickly as possible. Thank you.